Total health spending as a percentage of GDP was 5.9%. Meanwhile, the Latin American average is 6.9%.
Regarding the CT scanners, there are 3.4 per 1 million inhabitants. The average rate in the country of the Organization for the Economic Cooperation and Development is 20.6 CT scanners per million inhabitants.
There are 0.65 beds per 1,000 inhabitants, while the WHO World Health Organization recommends 1 per 1,000 inhabitants.
Although in the past 10 years the number of human resources has increased inside the health system, Mexico still has a big issue, which is the relative deficit of doctors and nurses.
One of the biggest problems in Mexico is the poor quality of the medical service in the public sector. There are not enough sources or specialists to provide health assistance. Besides, most of the people can't afford a private hospital, so they can't take care of their health in an appropriate way.
The general solution we as a team propose is to create an agreement where the private sector provides the use of its services and installations for the public sector in exchange of a condonation of a solid quantity of taxes. This way, the taxes will not be misused, and the percentage of taxes designated to the public health sector will be fully used to improve the quality and medical resources. As a law student, my solution for dealing with this issue, which affects Mexico in a powerful way, will be to create and regulate a new law which dictates that the private sector has to provide the public sector their installations, help them with personnel such as doctors and nurses, and in exchange, the government will be in charge of paying the quantity that was condonated to the private sector with the percentage of the annual GDP provided to the health sector.
Health is one of the most important things in life. Nevertheless, most people not take care of their health because they don't have enough money or they don't want to spend it in medical service when they need it. This is a reason why they choose to get medical assistance in a public institution. But in many cases, a public hospital provide a poor quality service or not come with the proper resources or material to give a correct service. For example, when it's needed a machine to give a diagnostic or to give a treatment. On the other hand, a private hospital is too expensive, and in most of the cases, the people can afford it. With the solution that we propose, the health system in Mexico will improve in quality and resources. If the public and the private sector work together, they will be able to provide a better service to the population. In conclusion, by this, it will be possible to reduce the morbidity and increase the life expectancy of the population.
Nowadays, gene therapy is used for the genetic diagnosis and infection diseases. Can also be applied to new techniques that analyze the human genome and that can detect new mutations. Last but not least, can be related to the production of new vaccines. In Mexico, a small group of people can afford private health care, and even a smaller group can make use of gene therapy. The advantage of the solution we propose is that new expensive medical treatment like gene therapy can be available to the sector of the population with fewer resources. Applying biotechnology to the health sector can be innovative and can also ensure the efficacy of the treatment and the safety of the patients. 400 of clinical studies around the world claim that 6,000 of monogenic diseases can be treated. Biotechnology offers us a healthier world that needs to be at the reach of everybody.